anytime you do any dentistry that does require anesthesia, obviously there's going to be some risks with that, but they're pretty few and far between. There's very few people that have allergies or issues with anesthetic. The most common one would be somebody that's a little sensitive to the epinephrine that goes in there that helps our anesthetic stay there longer. We just don't use that type of anesthetic for them. So that would be one area. As far as discomfort, one of the things that we try to work really hard at as far as the discomfort side of things is you know, doing that really great thorough exam up front to see if there's any underlying issues with that tooth as to what we're doing causing an additive effect to that. And in some situations we'll be right up front. If we're going to try to get this tooth to come back in alignment, there's no way we're going to be able to do that without this tooth being treated maybe with a root canal, or it has this infection that we need to clear up first, you know. So we'll take care of those things to have it be the least costly and the least uncomfortable, you know, for the patient, both in time, effort, money, okay, and obviously sensitivity. Probably the most common thing that I can think of, and it doesn't happen, I say most common, but a side effect that can happen is if a tooth becomes sensitive over time. And usually across the board it's only, say, maybe 8 to 10% of teeth that need to have a crown or a veneer. Veneer is probably not even this high, but a crown. Only like 6 to 10% of those will end up having sensitivity where a root canal would be necessary. But there's probably some underlying problems already in that. And that would be something in that new patient exam we would review and say, this is an area I think that if we're going to have a problem, it's probably going to be this tooth. And so in that bottom line, they're already going to know that that could be a risk, and is that something that they want to take on. But it could be that in their lifetime of that tooth would need to be treated anyway. So we'll talk about those kind of things. Sometimes with bleaching, people have some temporary sensitivity, cold sensitivity, but usually that's transient, that'll go away, but some people experience that. It doesn't necessarily mean that they can't be a bleaching candidate. Some patients have kind of sensitive teeth anyway and they want to lighten. Sometimes we take it a little bit slower, or we can introduce some medication into the trays on the off day that can help so that they can still lighten but it not be uncomfortable. Those are probably the most common maybe side effects that I see. As far as the dentistry itself being risky to the patient, unless they have some really odd medical conditions that we would want to definitely evaluate before we treat it, there really isn't a risk in that way that I can think of.